This video is going to talk about 3 different diseases that affect the cardiovascular system. So first up is going to be brucellosis. And brucellosis is caused by the bacteria Brucella melitensis. And this disease can be acquired when a human comes into contact with either an animal that is infected by Brucella or animal products that have been contaminated by that bacteria. Most commonly you see, kind of livestock like cattle and pigs and goats and sheep, sometimes dogs that are most commonly affected with this organism. But it is also really associated most often when we eat or drink unpasteurized or even raw dairy products, right? Sheep, goats, cows, even camels, y'all. When their milk becomes contaminated with the bacteria, and then if it's not pasteurized, remember that means exposing it to very high temperatures for a short amount of time. If it's not pasteurized, then if you drink that milk or perhaps eat cheese products from that infected milk, then you can get sick. It is also possible to inhale the bacteria or even have the bacteria get in through the skin. But that's much less common. Normally it is associated with the raw or unpasteurized dairy products. So brucellosis is also called undulating fever, and that's because what ends up happening, as you can see in this picture here, this reoccurring fever that is going to spike about every 24 hours is going to be the big diagnostic indicator. Excuse me. So we do call this an undulate fever because the body temperatures are going to undulate between day and night, and between elevated, normal, and subnormal temperatures. Oftentimes, this undulating fever is going to be accompanied by chills, profuse sweating, headache, muscle pain, because some of those non-specific symptoms as well. And this particular disease can last from anywhere from a couple of weeks to a full year. But luckily, fatalities are uncommon. So that's pretty good. All right, next up is going to be the plague, which is caused by one of my favorite bacteria, Yersinia pestis. And it's my favorite because it's a very interesting bacteria, and how it operates is very, very interesting. So the plague is going to be caused by the bacteria Yersinia pestis. And one form of the plague was responsible for millions of deaths in Europe back in the Middle Ages. Nowadays, it is not quite such a threat because we do have antibiotics that can treat the plague, so that's great. But without getting the proper treatment, it can lead to death, or at least to very serious illness. And we do see cases continually popping up kind of in the Western United States, more in the rural areas, but it is much more common in Asia and certain parts of Africa. So how do people get the plague? Well, this bacteria is associated, excuse me, with different animals like squirrels, rats, prairie dogs, rabbits, things like that. But it's transmitted from the host, or like the reservoir, to the humans via rat flea bite. Okay, so we are going to be talking about some vector transmitted diseases, and when that's the case, you definitely want to know the vector. But in this case, it is the rat flea. And so essentially what's going on here is Yersinia pestis is going to be just commonly present within some of these rodent populations. It doesn't really cause a lot of the rodents to die or anything, but so it's just kind of, present at low levels. And then those animals, as well as the fleas, are actually going to be what's serving as those like long-term reservoirs. And so when the most common way that people acquire it is from the bite of an infected flea. And so what ends up happening, sometimes during outbreaks, like the rodents are going to die, right? These fleas are going to be hungry. They're going to go after other potential food sources, aka blood. And so when people, and other mammals, excuse me, go to wherever these rodents might be, then their risk of being infected is going to increase. And so you always need to be on the lookout for being cautious when you're in areas that have a lot of fleas. And so it turns out there are 3 different manifestations of the plague, and they're going to differ by mode of transmission. So the pneumonic plague was the very fatal form of the plague that spread across Europe. And so that is transmitted via respiratory droplets. And then we have the bubonic plague, which is where normally the bacteria is going to be injected via the flea, or a flea bite, I should say. It's going to enter the lymph and it's going to be filtered, by a local lymph node. That's going to cause inflammation and necrosis of the node, which results in what we call a bubo. And that's what you see in the bottom left picture. And so again, those little buboes are going to be the key indicator of bubonic plague. And this has a mortality rate of only up to 15%. Not too bad, especially because with, like I said, antibiotics, it can be easily treated. But these forms of the plague can progress to massive bacterial growth in the blood, which is going to give the third type of plague, which is septicemic plague. And so once the bacteria starts replicating in the blood, it's going to cause disseminated intravascular coagulation and sometimes subcutaneous hemorrhages and purpura that degenerate into necrosis and gangrene. And so once it becomes septicemic, then mortality rates tend to increase to about 30 to 50%. And septicemic plague can be diagnosed by seeing this visible darkening of the skin. And that's actually how it got its name, the Black Death. So another way to identify this organism is by staining it. And Yersinia pestis displays bipolar staining. And so it tends to stain more darkly at the edges. And so we say that it looks like a safety pin under the microscope. The plague is pretty contagious. To get the plague, you only need to be infected with anywhere from 3 to 50 cells, and that's for either bubonic or septicemic. Yersinia pestis does have genes that allow it to cause disease, like I said, in mice and survive within that flea vector. But what happens is once it's in, a nice healthy host, certain genes that code for a capsule, one for something called plasminogen, those are going to be activated, and that's going to lead to clotting, and that's going to help the bacteria resist phagocytosis. But I want to talk just a little bit more about the vector, the rat flea. And the reason fleas are primarily responsible for transmitting the plague is because they have this really odd or interesting relationship with the bacteria. So once having, or after having, a blood meal from an infected animal, Yersinia pestis is going to multiply in its guts. And the esophagus of the flea is going to become blocked due to coagulation factors made by the bacteria. And so this is going to cause the flea to become super hungry because it can't eat properly. And so that flea is going to jump from animal to animal in a futile attempt to get food. And all the while, it is potentially transmitting Yersinia pestis to each of these animals that it's trying to feed from. So it's just really, really interesting to me, because it convinces the bacteria, convinces the flea to think that it's hungry. And so it causes the flea to jump to all these hosts looking for food, but really it's just passing the bacteria around. So it's a pretty clever mechanism. So yeah, essentially, again, we can treat this with antibiotics. There's no vaccine available, but if you do survive the plague, then you will have strong immunity towards it. Okay, last but not least for this particular video is going to be Lyme disease. And Lyme disease is caused by the bacteria Borrelia burgdorferi, and this organism is a larger than normal spirochete. So remember, spirochetes are typically very thin, very coily bacteria. But Borrelia burgdorferi is going to be a bit larger and thicker. It's only got about 3 to 10 irregularly spaced coils, and they're really loose coils rather than kind of tightly wound up coils. This bacteria also has a unique nutritional requirement, and it is difficult to grow and culture this organism in the lab. Borrelia cannot make its own carbs, lipids, or amino acids, so it has to acquire these nutrients from an extracellular source. And so that's why it's so difficult to grow. So Lyme disease is slow acting, but it can evolve into a more progressive syndrome that's going to mimic like rheumatoid conditions. So early on, the symptom that you would be able to recognize and therefore diagnose a patient with is going to be this bullseye rash at the site of a tick bite. And we call this rash erythema migrans. And so please note that the vector is the tick. And unfortunately about this bullseye rash, again called erythema migrans, only about 10% of cases actually take on this bullseye rash. The rash can take on various appearances. It can actually mimic like ringworm, and so early detection is sometimes missed because people think they have ringworm other than Lyme disease, and that's what's really problematic, because as the disease advances, the symptoms become worse and worse. And so along with that bullseye rash, you'll sometimes get, patients will get stiff neck and dizziness. But if it's either untreated or it gets misdiagnosed, it can lead to the second stage, which is going to be more cardiac and neurological symptoms are going to arise, including facial paralysis and oppressive fatigue. So it's like just hard to move or do anything at all, and even memory loss. And then if it continues to progress, it's like after weeks or months, so there's quite a gap here, people can get crippling arthritis at the joints. So it is pretty significant and impactful signs and symptoms here. Something else about this particular bacteria is that it can be passed through the placenta of a pregnant woman, and it can infect a fetus. We call that congenital transmission. Hold on. Okay. And Lyme disease is a systemic disease. The bacteria can actually be found in many different organs. But like I said, it is difficult to test for and to culture because of its unique metabolic requirements. So That is going to wrap up this video. Please let me know if you have any questions.